Are you thinking about getting Botox for the first time, but you're afraid? I don't blame you. I'm Dr. Sarah Allen, Chief Medical Officer of SkinClick. I always tell my patients before I got Botox for the first time, I probably thought about it for 5 years. I was afraid, I was nervous. You've never had this procedure done before, you don't know what you're going to look like. And sometimes you have a healthcare provider who may not be very understanding. They may not listen to your concerns, and you may not be confident in their skills, which only leads to your worsening anxiety about the procedure. I get it, and I've been there. And I knew there had to be a better way. That's why we started SkinClick. So here's what you need to know about Botox. Botox are also called neuromodulators. Basically, this is a fancy word that said your nerve affects your muscle. So Botox is a medication that's safe. It's been around, y'all, since the 1990s. And Botox is not only used for cosmetic indications, but it's also used for medical indications like vocal cord dysfunction, bladder dysfunction, esophageal, your swallow tube dysfunction, and many other things. But as with anything in medicine, this tended to be a little bit of a circuitous discovery. Botox was initially created for spasms in your eyelids called blepharospasms, but some really smart oculoplastic surgeons and dermatologists figured out that you can give this medication and it will decrease the appearance of lines. Thus, the cosmetic indication was born. So, how does it do it? Well, you deliver this medication and it actually travels to where your nerves meet your muscles. And there it does what we call cleave. It breaks a little protein. And because it breaks that, the little signal that normally goes to your muscle that says, hey guys, contract and move, it takes that out. And so your muscles don't move, they don't move as much. That's the whole goal of Botox. And because they don't move as much, your skin doesn't crinkle, right? Because you're not moving. And because of that, you don't develop deeply etched lines over time. So that's the whole premise of Botox or a neuromodulator. Now, activity typically comes back within 75 days for most neuromodulators. So you may say, well, is this going to last forever? No, it's not. For most patients, it washes out about 2.5 months. That's why providers typically recommend an appointment every 3 months because that gives you natural results and nobody can tell that it wore off. And we're going to talk a little bit more about that later. And Botox was the first. Remember, I said it was approved in the 90s, but now it's not the only. In fact, there are many approved neuromodulators in the US now. We have Xeomin, Jeuveau, Daxxify, Latibo, Dysport, and traditional Botox. We also expect another neuromodulator to be approved in 2026, but shh. And why does that matter? Well, all of them work. They have subtle nuances. Some of the dosing is different, but your healthcare provider does need to be well versed in the nuances of the product to be able to give you the result that you're looking for. The next most common question people ask me is, well, how much can I expect to get? That varies for everybody. And it varies really based on how strong your muscle contraction is. So if you furrow your brow like me and you make a deeply etched line, and I have a lot of Botox in there, and you can see that, then you're going to require more than someone who doesn't frown that much and can't make those faces. People always say, well, is it dependent on my age? The truth is, no, it's not. It's dependent on your muscle contraction and your anatomy. Now, you may say, okay, great. I've made up my mind. I'm going to go in, I'm going to get my Botox, and it's going to work tomorrow. No, it's not. Not likely. Odds are it'll take up to 10 days to 2 weeks to fully set in. And you should know that during that time, one eyebrow may be higher than the other. And that is completely normal because the medication sets in at different times throughout your face depending on your anatomy and how many nerve to muscle connections you have and how long it takes to address those connections. So you can imagine there's a lot at work in your body when you get this medication. One question I'm asked all the time is one medication better than the other? The answer is no. They're just different. But I will say, if you prefer Coke over Pepsi, then you may be someone who has a love of a certain neuromodulator. But the truth is, I've used all six. I've put all six in my face. they all deliver results, and that's really what you're going for. I think what matters most is the skill of the person who is putting the medication in you. What can you expect right after your procedure? Well, some patients get a headache for the first 48 hours. I typically tell my patients that's because you're trying to strain against the medication. You're trying to make faces, your medicine's setting in, and so that's to be expected. You can take ibuprofen or Tylenol, acetaminophen, if you need to for discomfort. The next thing that you can expect is a feeling of heaviness sometimes, particularly in your forehead. Think about it. We're making it so your forehead muscle really doesn't move as much as it used to anymore. And with that, you may just feel like you have a heaviness, a concrete. Some patients say they feel claustrophobic. That's all completely normal. That can last for up to 4 to 5 days. That will completely lift as your treatment sets in. You may expect a little bit of bruising, but typically most patients do very well. But otherwise, you can expect to sit back, relax, and enjoy your results in 10 to 14 days. When you ask, how much do I need? The truth is, you could need anywhere from, I would say, low 30-ish units all the way to over 100 units. It depends on which areas we're addressing, how strong those areas are, and what your desired outcome is. And listen, I get it. These treatments are not inexpensive. So patients often come in and say, I'd like to spend this. And your healthcare provider should always give you options, but I typically recommend that my patients focus on 1 to 2 to 3 areas treated appropriately rather than sprinkling everywhere a low amount that's only going to last for 30 to 45 days and decrease your satisfaction. Is not likely to give you much outcome. You may say, why do I need to come back every 3 months? Okay, well, remember again, we talked about most neuromodulators last 75 days. And because of that, if you would like to have a natural, consistent appearance over time, that's why we typically recommend every 3 to 4 months. The number one thing I hear from my patients sometimes is, I don't want anybody to know that I have this done. Well, if that's the case, you need to be consistent with your treatments, because if you're not, you'll have movement come back and people will be able to tell when you have it done again. What's one thing I wish everybody who is getting neuromodulator treatments knew? You have to use SPF as daily prevention. This is the number one thing you can do for the appearance of your skin long term, and to decrease the leathery and varied skin texture you may develop over time. Botox certainly contributes to a smooth appearance of your face, but you have to have that coupled with prevention. Add on a good, consistent skincare routine, and you're off to the races. Where's my favorite underrated area to treat? Well, everybody knows about your frown lines, your forehead, your crow's feet, but most people don't know about your lower face and the impact that that can have with the treatment. I love a lower face treatment in my patients, and they tend to come back and say, wow, I really loved that last time. And I always tell patients, you want to be the same age on the top and the bottom, don't you? So it's best to treat all of that in conjunction. If you found this video helpful, like, subscribe, and share with a friend who has their appointment coming up. And if you have any questions, please feel free to drop those in the comments. My favorite thing to do is to answer questions for patients.